I see the team is up, so kick it off, Marilyn.
Okay, well, there's not a lot of new news to report. We remain in yellow tier. We continue to move forward towards moving beyond the blueprint as of June 15th. We have, as of the week of 5/22, our weekly assignment to the yellow tier is based on having 0 cases and 0 positivity. Again, that's for the week ending 5/22. We will likely show some cases in the tier assignment next week, because that will reflect a couple of the cases that we added last week. Our vaccine coverage rate continues to be pretty strong, in line with the state. And I think Anna's going to provide you a brief overview of the new campaign that the state has initiated to encourage more people, those who perhaps have delayed getting vaccinated or are sort of sitting on the fence. There's a new incentive program. And so I'm going to just turn this over to Anna and let her take it home.
Thank you, Anna Scott. I just want to give a little bit of an overview on the Vax for the Win campaign that the state of California announced last week. As we move towards beyond the blueprint in a couple of weeks, we are making a last push to try to get as many people vaccinated as possible before we largely reopen our businesses and other venues to remove a lot of the restrictions that have been in place throughout the pandemic. So this initiative includes some cash prizes and gift cards. So essentially, as of the 27th, this promotion went into place at the state level, and individuals, the first 2 million who become vaccinated after the 27th of May will receive a $50 gift card. So that's one component of this incentive program. There are also a couple of large cash prizes. So on Friday, there will be a drawing for anyone who has received at least one vaccine. There will be a drawing for 2 $50,000 prizes. And then next Friday, the same will happen for an additional 2 $50,000 prizes. And then a 1.5 million grand prize lottery sort of event that will be done later in this month, as of June 15th, as we move into the beyond that blueprint. So you may see some information about that, and or if you're vaccinated, you will receive information on how to claim your gift card if you're just getting over to the vaccine clinics this week. We also continue to have vaccine available widely in the community through our vaccine providers in Inyo County. And so still continuing to provide all 3 of the authorized vaccines. We have Pfizer vaccine clinics happening currently at Northern Inyo Hospital, at Vaughn's, and at Valley Health Team. We are working on expanding that availability as well. We have Moderna available through many providers, including several of our pharmacies, and that includes Toyabe, Duane's, Rite Aid, and then we also have some Johnson & Johnson or Janssen vaccine available as well at a couple of our pharmacies, specifically Rite Aid and Duane's at this point. So we are continuing our vaccine initiative. We'll be doing some second dose clinics next week in Bishop and Lone Pine, and we'll have more people fully vaccinated at that time. Also happening right now are, we're approaching the end of the school year, so I want to mention too that we're going to be seeing some graduation ceremonies happening this week and next. Moving forward with closing out this school year, we've been fortunate, I think, in Inyo County that we've had have been able to do some in-classroom learning with many of our students, and we'll be continuing to work through public health, working closely with our superintendents through the summer as we move into the next school year. Certainly have the expectation that we'll have a more normal year next year, and a lot of planning to get there with support from the state and the federal government as well, to get to that place where we have more schools throughout the state open, as we were able to do in many of our districts this year, but move into a more normal schedule, more kids on campus, and move into a better situation for our students. So we'll be continuing to work on that through the summer. Those are the updates that I have. Dr. Richardson, anything to add?
Dr. Richardson, you're on mute.
Okay, while we're waiting for Dr. Richardson to maybe come back, does anybody have any questions for the health team? Okay, doesn't look like it.
Well, I have one question. Are you guys starting to get bored?
Not quite.
Starting to get really excited.
Okay.
Are you planning a vacation, Anna?
Yes, many of my staff have not been able to take time off this year, so we're trying to get a couple of days off here coming up soon.
Nice, wonderful. You deserve it.
A year well done.
Okay, well, Jennifer, did you have something?
Yeah, I guess I will ask. Perhaps the public health order was rescinded. Maybe if you wanted to just, I know there was a little bit of confusion, so maybe it would help to.
Yeah, I'd be happy to speak to that, and thank you for bringing that up. This does cause a lot of confusion. We last year had Dr. Richardson had established a stay-at-home order, local public health order, and as the state was moving out of that, moving into more of a tiered system, we rescinded that order and experienced some confusion around that, because really we're then following the state orders. So more recently, in the last week, Dr. Richardson rescinded the local face covering order that had been in place for about a year. And that really was in anticipation of some changes that will be coming up likely over the next few weeks, as well as we move into beyond the blueprint. We wanted to make sure that the local orders were not more restrictive than the state orders. So that face covering ordinance was rescinded, but then that means that we are still subject to state face covering guidance. So we are still subject to the current guidance that's in place in the state of California. And right now that includes continuing to wear a face covering indoors when you're out in the public, and then also for very large events. So outdoors, if you're fully vaccinated, you don't have to wear your face covering, but if you're at a very, very large event around a lot of people you're not normally around, still asking people to wear their face covering.
Okay, you're back, Dr. Richardson. Did you have a report for us?
Sorry for the internet problem. I don't have a lot to add. Everything seems to be low in prevalence, which is encouraging. It's my sense that as we move along and through the summer, it'll stay that way, since we're doing well on vaccinations and the numbers are low. I suspect by fall, the numbers are still going to be low. And I think the schools most likely will be open as usual with normal in-class instruction. That's a very good goal that I think should be achieved. And given the climate of going back to school across the country, I think that's going to happen. Whether or not there's going to be mask requirements, that'll be depending on the prevalence of activity in the community and also the vaccination level of the staff and teachers. That's about it I have to say today.
Do we know, are there any restrictions on summer camps for kids?
I have not heard of any. I'm sure that topic will come up.
There is
I've heard
guidance
that
in
there
place for
is
some.
vaccine, maybe vaccine certification. Other than that, I haven't heard anything specific. Our contact tracer and the event individual that studies these problems, and Anna may have some information about that, works around those venues.
Yes, I'll just add there is some guidance for summer camps. They are allowed to occur, but with some mitigation currently in place in the current guidance.
Okay, thank-
One other question, I don't know who's best for this. So we're approaching the 15th. Are we starting to get more clear idea of what will happen after the 15th?
From
We are
the
getting,
conversation, go ahead, Marilyn.
I'm sorry. We are getting some indication around the state's plan as of the 15th is to pretty much follow the CDC guidance as it relates to face covering, but there are still some, the restrictions around business sectors and, will be lifted in large part, but there are still other guidances that I think the state is continuing to work on and finalize, and Anna might have more information on that. And it's also important for businesses that are under OSHA governance that there are, that OSHA does have a layer of requirements that even if the state were to, remove all masking, OSHA guidance would still have to be adhered to for businesses subject to those provisions. So they did issue last week a proposed guidance that I believe they're accepting public comment on right now, and will determine how to proceed this Thursday, if I'm not mistaken. And Anna, do you have anything to add?
Yeah, just briefly, as we move to the 15th, there is one particular set of guidance that actually has been released and will continue to be in effect, and that is guidance for what the state refers to as mega events. So that's events where there's more than 5,000 people at an event indoors or more than 10,000 people at an event outdoors. And so there will continue to be some guidance around those very, very large events where especially where there's uncontrolled mixing and a lot of people getting together, and especially things like conferences and fairs and very large venues where we expect that it's not just people from the immediate community getting together, but people from outside of that community, or even potentially as we move through the summer, more international visitors. So there will continue to be guidance in place around those mega events, but the restrictions around capacity limitations and physical distancing are going to be lifted with the rest of the specific industry guidance as of the 15th.
Okay. Well, thank you, everyone, and appreciate the report. See you again next week. Okay, so a note on